Good afternoon. My name is Princess McCormick Lynch. The purpose of this assignment is to conduct a biopsychosocial assessment with the client. This is for social work direct practice at Troy University online for the master's program of social work. The purpose of this assignment is to get me more acclimated with being able to interact with clients as well as conduct assessments. Good afternoon, Mr. Bailey. My name is Princess McCormick Lynch. Today we'll be conducting a biopsychosocial assessment. We'll be looking at things within your life that are contributing to the reason why you're here today. Okay? All right. I just want to go over some documents that you signed earlier, just to reiterate to make sure you understand them. One was a Privacy Act, one was a confidentiality statement, an informed consent statement, and then as well as mandated reporting laws. So Privacy Act and confidentiality, you have the right to privacy here. Your medical records will not be released unless required by a subpoena from a court of law. As far as informed consent, sometimes we do have students here that they utilize the information gained from assessments within research, but there will be no distinguishable factors to where they'll know who you are. There'll be basic demographics and then as well as mandated reported. I'm a mandated reporter. There are certain things that if you discuss with me, I have to report them up, such as child abuse, domestic violence, elderly abuse, suicidal ideations, and homicidal ideations. I care about your safety as well as the safety of others. Okay?
Well, I'm gonna tell you now, I ain't got none of those for real, but you test me, and we're gonna have a problem.
Okay. So I want to start off by going over a few just minor background things. Can you tell me your full name?
Dominic Bailey.
Okay, Mr. Bailey, what do you prefer to go by?
Almighty.
That's an interesting nickname. How'd you get that?
Because like I said, I'm easy, but you test me, I'm gonna give you the Almighty.
Okay. Well, do you feel comfortable with me calling you Dominic or Bailey?
Bailey's fine.
Okay, Bailey. Can you tell me your age?
I was born January 1st, 1984. I'm 38 years old now.
Okay. Can you tell me your current race or ethnicity?
I'm as black as they come.
Okay, so you're African American.
Not African, just American, black American.
Okay. Thank you for that correction. Can you tell me what brought you in today? Why you're here?
So you people in this medical police world or whatever felt that they needed to bother me and my dog. I live under the bridge, and I choose to live under the bridge. And the officer got too handsy with me, so we had to have fisticuffs. And for some reason, he believed that I should be here, so I'm here.
Okay. So for what you just stated, I gathered that you got into a physical altercation with a police officer?
He got into an altercation with my fist, yes.
Okay. And you mentioned a dog. You have a dog?
Yes.
What's your dog's name?
Rocky.
Rocky. What kind of dog is Rocky?
It's a good dog.
Okay. So I'd like to ask you a few questions in regard to medical history.
Mm-hmm.
So have you been diagnosed with any mental health related diagnosis?
Well, you know, this Western medicine foolishness says that I have depression and anger issues. I don't understand why you think I have anger issues. I'm a happy guy. See? Happy.
Okay. Well, regarding your mental health, the anger and the depression, have you ever been seen or talked to anybody before coming in today?
So I was in the Army for 20 years. I recently got out this past year. I joined when I was 17. I had my 37th birthday a little while after I got out the Army. So I was working in the position, the job that I work in. Don't ask me what it is, but there's some planes, there's some shooting, there's some bombs, stuff like that. Mm-hmm. You know, you don't tell people that you're hurt or you're sad or whatever. You keep your feelings to yourself. So to answer your question, no, I kept my feelings to myself. But since I'm not out of the military, for me to get my check that I've earned, I have to go see some guy and talk about feelings twice a month.
Okay. So from what I just gathered, you stated that you've been seeing someone now twice a month since you've been retired.
Yes.
Okay, so that's probably been about 7 months now?
Give or take, we'll go with that. Sounds good.
How are those sessions going for you?
Oh, it's great for me. It's a waste of time for him. I mean, he's a quack. You know, he gets the government money twice a month. I sit there, I eat whatever snacks he has there, because I believe those are my snacks on there. I pay for them with my tax dollars. And, yeah, I like the free air conditioning.
So it doesn't sound like your counseling sessions are beneficial at this moment.
They're fine for me. It makes me laugh.
Okay. Have you had any inpatient stays?
Once a quarter. So I've done twice. I got out maybe about a year at this point. I go to the hospital. It's really nice. There's really nice nurses there. They're pretty. So I go and just, get in their way, waste of time. So I'm there for a few days. I bother them, see if I still got it. And yeah.
While you're there, have they prescribed you any medication?
Antidepressant, mood stabilizers. Yeah, it's whatever.
Do you remember the names of these medications?
Nope.
How often are you required to take them?
They bring them to me every few hours. I think that the antidepressant maybe twice a day. I'm normally there for a few days. It's almost my nap time, so let's wrap this up. Time to go Betty bye.
Okay. So outside of your hospital stays, do you take medication normally?
I mean, I believe in the natural medication.
Okay, what does that mean?
Oh, I take a smoke a little weed.
Okay.
But they say a joint a day keeps the doctor away, so I make sure I smoke a little weed daily.
Okay. I meant to tell you earlier, thank you for your service.
Oh yeah, thank you for your time.
Okay. Are there any medical conditions?
Half of my body is reconstructed by the military. Like I said, there's some planes jumping out of them, bombs shooting. So yeah, it's about that. So I'm fully medically retired. They're ripe at the age of 38.
So it sounds to me like you've had multiple surgeries.
Yeah.
Can you tell me the areas where you had these surgeries?
Everywhere but my left leg.
Okay, when you say everywhere, are you...
Shoulder, back, knees, collarbone, elbows, hands, face. I had a few TBIs, so yes.
In regard to your TBIs, they were military related?
Of course. And if they weren't, of course they were. I was in the Army 20 years. You can't tell me anything before that is my fault. It's your fault.
Does anyone in your family have a history of mental illnesses?
I don't know them. I was adopted.
Okay. What age were you adopted?
Whatever age they found me, I don't know. Like birth. I don't recall. They told me at 18 I was adopted, so I was adopted.
There was no information that you have regarding
Didn't
those
care.
circumstances?
Didn't care.
How are you and your adoptive parents?
They've transitioned.
How did you deal with their loss?
I was deployed. I didn't know until I got back.
When you got back, what experience did you have?
I was angry, sad. I cried. But they left me a lot of money.
Did you have a close relationship with your adoptive
Of
parents?
course. I loved them. They loved me. And they told me I was adopted, but I didn't care.
Do you have any siblings?
I don't know. I was adopted.
Do you have any adoptive siblings? Did your adopted parents have any
Oh, yeah,
biological
yeah.
children?
They had
Were there
older
other
kids.
children in the house?
Yeah, their kids were older. They wanted a baby and they found me. So
Okay. Are you still in contact with your adoptive siblings?
no, not really. They're like much older than me.
How many older adoptive siblings do you have?
4, 2 and 2.
2 and 2, 2 brothers?
It's like a 2-bedroom, 2-bath. It's 2 brothers, 2 sisters.
Okay, thank you for clarifying that for me.
Come on, Doc. I need you to be quick here.
Okay. How was your childhood?
It was great. I love my parents. They loved me.
Okay, when you say great, what does great mean?
They let me do everything I wanted to do. They encouraged me. It was amazing. That's why I joined the Army. Dad he was in the Army, and Dad said you should do it. School was never my big thing initially, but that has changed over the years. The discipline and growth was amazing.
So it sounds like you're following in your father's footsteps.
Yes.
I commend you for that. What's your current relationship status? Are you currently seeing anyone? Were you previously married, divorced?
So, my dad was in a Rolling Stone, but I was. So, I am, what's the proper term these kids use these days? A monogamous anarchist. So I don't believe in like monogamy.
I've never heard that term. That's something new for me.
I taught a doctor something new. Look at that.
You did. You did.
Or a serial dater, whichever one. So I am technically, by your simple standards, single.
Okay. Have you ever been married?
No.
Do you have any children?
15.
How's your relationship with your children?
They get a check every month. They're good.
How often do you see them?
I don't. They don't come to my tent underneath the bridge, so I don't see them.
What's the age ranges of your children?
Little to a lot. What do you need?
Do you have a baby, a toddler?
No.
Do you have
So it's like
adolescent
the oldest
children?
is 20, and the youngest is 8.
Okay. How many daughters? How many sons?
I don't remember.
So it sounds like you're not actively involved in
Oh,
their
no,
lives.
not at all. They get a check.
Okay.
They're better off without me. They get a check.
We'll have to work further on that statement. Your current living situation, I've heard you mention under the bridge. Are you telling me that you don't have like a physical residence right now?
It is a physical residence. It's physically under the bridge.
When you say under the bridge,
I live in a tent, me and Rocky, my dog. Remember I told you that. I have a nice, like 10-man tent. It's really nice. I have a little, air conditioning unit in there, and I live as free as they come. Don't pay any taxes, no high homeowners association, none of that. I am living comfortably. It's great. It's a whole community out there.
okay, where's this located?
Underneath the Golden Gate Bridge.
Okay. As far as school, what was your highest level of education attained? Did you graduate high school? Did you go to college?
Of course.
Okay, tell me more about that.
So believe it or not, Doc, I'm a doctor too.
Oh, okay. Would you like to remind me?
I just told you I'm a doctor. What else is there to talk about?
Where'd you get your degree in?
So I have a PhD in strategic leadership. Which is why my children get a check, because the sound decision is not to draw them down into my problems, but to make sure that they have a meal. Everyone wins here.
So although you're not as active, it seems like you actually care about your children.
Of course, all 15.
Okay. What about your current employment?
My employment is go to see this guy twice a month so I can get my disability check.
So you're saying your only source of income right now is your disability check and I'm guessing your retirement?
Yeah. What else would I? Why would I else would I go do 20 years in the military?
Okay.
All right. It's like 13 out of 20 at this point, but it's okay.
So let's talk about your military history.
Mm-hmm.
You said you were in 20 years. What was it like?
It was amazing. I got to jump out of stuff, blow stuff up, shoot at stuff. It's nothing like shooting a weapon for the first time. It's amazing.
I can imagine you were airborne because you mentioned jumping out of stuff.
We'll go with that.
Okay. I'm not sure if that's the correct term.
Super duper paratrooper.
Okay. So, how many times have you been deployed?
Many times. Hard to count.
That you can remember, if you can give me like an average number somewhere in the middle.
5 or 6.
Okay. How long were your deployments typically?
Oh, I was there for the surge. I was there at one time for sure, 4 years. Just there.
What's your shortest deployment?
9 months. It was weird. By the time I got comfortable, it's time to go. I said, let's not do that ever again.
Okay. What types of areas did you deploy to?
Everywhere.
Everywhere.
I was places that you didn't even know were available.
Yeah. What about combat?
All of them. What do you think this is?
So these are all combat related deployments?
Of course.
How was your transition back when you came home from your deployments?
I came back off the plane and I had dinner.
Who'd you have dinner with?
Myself. Or a young lady that I might have met at the Texas Roadhouse.
Sounds like, is that one of your favorite places?
Oh yeah, that cinnamon butter is amazing.
Okay.
I'm happy just thinking about it now. I always stay there about 15 minutes, and I'm pretty much happy.
So in regard to the combat-related deployments, you mentioned TBIs earlier. Have you had any other diagnosis in regard to that?
Nope.
Have you ever been talked to about PTSD?
Oh yeah, I have that too. It's natural. You're not supposed to see these type of things for 20 years.
Have you received any care for that?
I've had, like I said, mood stabilizers, the medication they try to give me, and I've gone to I like to go to yoga and stuff like that. It's things of that nature level my mind. They have a lot of, outdoor yoga by my residence. So I go out there and, get my yoga on, downward dog, tree pose, stuff like that.
Okay. If I were to talk to you about PTSD, are there any things that you can identify that are current triggers for you?
Being told what to do.
Anything else?
Nope.
Any sounds?
Nope.
Any singing?
Nope.
Different people?
No.
Okay. Next question. What are your current religious beliefs?
I'm spiritual.
Okay.
Something or someone brought me back here.
Okay. Do you practice any
Nope.
activities in regards to your spirituality? Okay. Do you have any current legal issues pending outside of?
Yeah,
Okay.
my money that this man got me tied up because I didn't see every reason. It's legally immoral.
Okay. No pending court cases, probation, anything like that?
The cop brought me here, so we didn't have to do any of that stuff.
Okay. So I'm gonna slightly shift back to mental health. Have you ever had any thoughts of harming yourself or others?
I love myself, would never hurt myself. Not others. I'm not a killer, but don't push me.
So it sounds like you have no issues defending yourself
Exactly.
if necessary.
Exactly.
Okay. In regard to your anger, how have you managed your anger in the past?
Sleep. Hang out with my dog Rocky.
Is there anything else that helps?
Nope.
At what first age did you?
Drink 3. Had a little beer and haven't put it down since.
Okay. What will you consider continued use?
So let's make this quick. I only drink, I only smoke weed. I don't do any of those other weird drugs. Drinking, I drink every day. Smoking, I smoke. Same thing every day. It helps my day go by. It's a good time. I sit underneath the bridge and I talk to other old timers who are more seasoned than I am, and we talk and we spend the day together. And I found a family that understands me.
Okay. Well, during your drinking, how much do you normally have typically in a day?
As much as is available for us to drink. Some days we have maybe 1 can between the 2 of us, 3 of us. Sometimes we have a couple of cases. Depends on what we can scrounge up.
Okay. So typically you drink beer?
Yes.
Okay. What about hard liquors?
If they bring it to me, I'm gonna drink it. I like brown liquor.
If you had to give me an average, how many beers you drank a day?
A case a day and maybe a bottle every 2 days.
Okay. And what about your marijuana use?
Oh, that's at least 4 joints a day. Got to keep the doctor away. I was working until a police officer wanted to bother me.
Okay.
Now I got to see you, doc.
When was your first use of marijuana?
Preteen, 10, 12.
10, 12. How would you consume at the time? How are you?
I mean, a little bit joint here, joint there. However, now, an ounce a week for sure. Up to 10 ounces a week. I gotta keep the doctor away. So I'm hoping when I leave here, I won't come back.
Okay. How were you introduced to marijuana and alcohol?
Oh, cousins, relatives.
Are you still in contact with these relatives?
Nah, not really. Some of them use that other stuff and it doesn't look as a grave.
Okay. Do you have any history with any other?
Nope.
What about prescription medication?
Nope.
Now, when you had your different surgeries, were you prescribed medication?
Ibuprofen, the only thing the army tic tac, the military tic tac, ibuprofen. Everything else, you can get addicted to it. That's craziness. Addiction is weakness.
No pain medication, anything like that?
Ibuprofen.
Okay. How do you feel about your substance use?
You said my substance what?
Substance use, your alcohol use, marijuana use.
It's the way of life. What do you need? I don't feel any type of way about it. I use it, and then I'm happy.
In regard to the incident that brought you in with the altercation with the police officer, had you been drinking that day?
No, I hadn't. He interrupted my morning routine.
Had you smoked that day?
He interrupted my morning routine.
Okay. When's your last use?
2 days ago. I was got here yesterday. And I'm here with you today, so it's 2 days ago.
Would you say your drug use impacts your life at all?
No. Actually, I would say yes, it impacts it. Makes it better.
So if we were to discuss things that you would like to work on while you're here, what would you think?
Leaving here as quickly as possible.
Okay. What do you think would help you be able to get out of here?
You giving me my paperwork to say that after his nap he can go home.
Have you ever considered substance use treatment?
Like AA?
I wouldn't say AA. I would say more of a group therapy where you can talk to other people that may
No.
have similar
Keep your
experiences.
emotions to yourself.
Alright. I'd like to thank you for your time and answering my questions today. I appreciate you being open to share with me.
I'm here for you, man. So that slip to say that I'm fine. I can go home, and I would like to resume my daily routine.
Well, it'll have to be discussed with the treatment team, and then someone will talk to you about the assessment.
Well, thank you, man. Have a wonderful day.
Post-recording thoughts today was very interesting. I asked my partner to kind of pick a mental health related topic, and I would just go with it. And I was not prepared for them to be as difficult as they were. So I realized that those are skills that I need to work on, rolling with resistance, not second guessing myself when I'm talking to a client, and learning to build better rapport when I'm dealing with a difficult client. Overall, I think I did a pretty decent job, seeing as I have not interviewed anyone in 2 years, but it was not the most easy video to do and it was not extremely difficult either. So I'm completely open to feedback, and I'm looking forward to getting better.